The CT angiogram of a young man about 28 years old. He had varicose veins, rather extensive varicose veins along right lower limb. Multiple sessions of sclerotherapy were carried out, but to no resolve. This is the CT angiogram of right lower limb. There are multiple venous hemangiomas. This is the arterial phase. Please observe sizes of both the limbs. In the venous phase, I will show you now. Please observe these flabellets here. I go up again. I scroll it down. Now I will show you its venous phase. Now please observe this venous hemangioma in the lower part of right gluteus maximus muscle. This one is here. There is no significant arteriovenous shunting. I did Doppler of this patient today, and there was normal triphasic blood flow in all the blood vessels of lower limb up to dorsalis pedis artery. So this one lies in the lower part of the gluteus maximus muscle. From this place you can see the feeding vessel from the profunda femoris artery and its venous drainage. Now please observe dilated varicose veins along the posterolateral surface of thigh. Some of these are thrombosed because of the different sessions of the sclerotherapy. Now this is another venous hemangioma. Please observe atrophic vastus intermedius muscle, vastus lateralis muscle, long head of biceps femoris, semitendinosus muscle. Now this extends downwards into the popliteal fossa along lateral surface of the knee. Please observe varicose veins. Short sickness vein is thrombosed because of sclerotherapy. Please observe the difference between the diameters of both legs. So this is not a case of Klippel-Trenaunay-Weber syndrome or Parkes-Weber syndrome. Now lower down, there is involvement of muscles of the anterior compartment, namely the tibialis anterior muscle, extensor digitorum longus muscle, and there is extensive involvement of the muscles of posterior compartment, flexor hallucis longus muscle, peroneus longus muscle, soleus. Now this venous angioma, it extends downwards along dorsum of the foot. Here it has involved the extensor digitorum brevis muscle, peroneus brevis muscle, and extends downwards in this region. It is mainly fed from the branches of dorsalis pedis artery. In these interosseous spaces, you can see that this venous hemangioma, it extends into the anterior part of sole of foot as well. Now I scroll it back again to show you its proximal drainage and communications. Now please observe the dilated cremasteric veins. Visibly, patient had the varicose veins along scrotum. Now please observe these veins along the inside and along the prostate, along right seminal vesicles. This is the internal iliac vein, which ultimately drains into the left common iliac vein. So there are multiple venous angiomas, and there is typical muscle atrophy, fatty infiltrations, and a reduction in the girth of the lower limb. In cases of Klippel-Trenaunay-Weber syndrome, there is leg length discrepancy. The diameter of the leg is increased and the limb is longer as compared to the other healthy limb.